Content warning. This video discusses workplace abuse, institutional exploitation, and the psychological toll of working inside a broken system. If you're a healthcare worker, teacher, first responder, or anyone who's been ground down by the place you gave everything to, this one might hit hard. Take care of yourself. Crisis lines are in the description. In video 1, I gave you the framework, 8 mechanisms of coercive control. In video 2, I showed you how those mechanisms operated in my marriage. One abuser, one victim, one home. Today, I'm going to show you the same pattern at a different scale. Because when a venture capital firm buys a healthcare company, the patients and the clinicians become the controlled population. And the mechanisms are identical. I was a psychiatric nurse practitioner for 25 years. I have treated thousands of patients doing med management over those years. I worked in geriatrics for years, then later specialized in complex trauma, PTSD, ADHD, and personality disorders. I loved this work. Being a nurse was my identity, my purpose. And the system eventually consumed me. The same way Damien consumed me. The same cards, different abuser. And if you've ever said, I can't leave this job because I need the health insurance, this video is for you. When I started, the practice was small, run by clinicians. A psychologist was the director, and he actually cared about patient outcomes. I had an office manager who knew my patients by name, an administrative assistant who handled scheduling, callbacks, and prior authorizations. I could focus on what I was trained to do, treat my patients. Then a venture capital firm acquired the company. The new executives didn't come from healthcare. They came from computer companies, insurance corporations, tech. One had left an insurance company after it was sued for fraud. I looked them up. This is public record. They weren't clinicians. They were extractors. And their job was to make a publicly traded healthcare company profitable for stockholders. The caring people started leaving, retiring, resigning. One by one, the people who understood patient care were replaced by corporate yes men. It didn't happen overnight. It never does. A little at a time, just like at home. So, things started getting worse. My office manager resigned during the COVID lockdown, and I didn't get to say goodbye, and she wasn't replaced. My administrative assistant left. 2 temps came and went. Then these positions, people I knew, they went into an office pool, an anonymous group of administrative assistants that rotated responsibilities. Nobody knew my patients anymore. Nobody knew the context of what was going on with them. So if a patient was in crisis and I sent a message, person A in the office pool would handle that. If the crisis continued, then person B in the office pool would get the next message, with no knowledge of what person A had done, other than maybe a brief note they left in the system. And these were psych patients in crisis. They deserved better than that. I asked the management to keep the same person for continuity of care for my patients. They said no. They told me that would be showing favoritism to me. Favoritism? For wanting a consistent person to help my patients not die? My clinical peers were just as overwhelmed. Nobody had time to consult, cover, or support each other. And we were isolated in our own caseloads, drowning separately. Especially when we were all remote after the pandemic lockdown. In-person consultation was replaced by messaging and emails. Now, they didn't call it surveillance at work. They called it, we're tracking your productivity metrics, RVUs, relative value units. That's what I was worth to the system. Not patient outcomes, not whether anyone actually got better. Units. Are you meeting your RVU targets? Are your no-show rates acceptable? How many visits are you making per day? Everything was measured, everything was monitored, not for quality, but for extraction. And this one is a masterclass, I must say. When I started, the deal was transparent. I see patients, the company bills insurance companies, we split 50-50 whatever the proceeds are for the visits. I get reports showing every visit, every payment, every time I got a check. I's dotted, T's crossed, I knew. Then management said, we're going to do you a favor. We're going to pay you prospectively, in advance. So you don't have to wait for insurance reimbursement. We'll take the risk for you. I mean, sounds great, right? And we didn't have a choice either. Except, no more reports, no transparency. And my split quietly went from 50-50 to 48 for me and 52 for them. And I was earning less. Eventually, I asked for the financial reports about how I was being paid. Actually, a colleague and I both asked, because we'd seen lawsuits in other states for underpaying the clinicians. And the answer was, it's complicated. We'll get back to you. It took weeks. And no clear report that made my paycheck make any sense. They just sent me mass amounts of data that was hard to decipher. Meanwhile, my workload went from 45 hours a week to 80, and my pay went down, about $10,000 a year, while I was working nearly double the hours. And I had a non-compete clause in my contract. Couldn't practice within 30 miles if I left. Couldn't take my patients with me. Couldn't sue, only arbitration, a process they controlled. And I needed the health insurance. I was the primary breadwinner during the pandemic. I couldn't just leave. Not that easy. Does that sound familiar? If you've ever been trapped in a job you couldn't leave because of benefits, a mortgage, bills, you built all them when the job was still good. And that's not a coincidence. That's a design. When I raised concern about my workload, I had 600 plus patients, 80-hour weeks, no administrative support, or very limited. The response was, you have a time management problem. The system created impossible conditions. Then they blamed me for not thriving in impossible conditions. That's not time management issues. They used the same tactic Damien used. You're the problem. You just need to be more efficient. You need to manage better. Gaslighting. And patients were complaining about fraudulent billing. Charged for visits they didn't have. Charged for late fees and no-shows that weren't relevant, inaccurate fees. No answers. I checked the Better Business Bureau, thousands of complaints nationwide on this company, but their public narrative was, we're expanding access to mental health care. Then came the patient portal. Patients could message me directly. Sounds like better care, right? Except a lot of the messages weren't clinical, and I had to field them. They were billing questions, administrative issues, insurance problems. But I had to read everyone, and then I had to forward them to the departments that might or might not respond to the patients. Unpaid work. I was only compensated for patient visits. So, in the end, this left 3 or 4 hours a day of admin work, like returning messages, forwarding them, prior authorizations, disability paperwork. That was on me, including on sick days, including on vacation days. So I really had no time off for years, because the patient still had needs and nobody was assigned to cover. I sent emails documenting this. I'm out sick with COVID, and I'm covering for myself. No response, no support, no coverage arranged. My boss said, arrange your own. My peers said, no, we can't do all that work. And you can't think your way out of a trap when your brain is running on fumes. And they know that. The non-compete clause, the arbitration-only contract, the implicit threat. If you leave, you lose your patients, your income, your insurance, your career within 30 miles. They didn't threaten me with fists. They threatened me with lawyers and logistics. The violence was structural. Executives made millions. Stockholders got dividends. I loved reading the stockholder reports. Clinicians got, you have a time management problem. When I wanted to take a medical leave, I asked management what would happen if a med prescriber got hit by a car and was in a coma. Shouldn't there be a medical leave policy for that? My boss said, "That's never happened before that I know of. We don't have a policy for that." They advertised to stockholders that they had over 20,000 prescribers nationally. That means money for them. But they have no policy for what happens if one of us breaks. What happens to the patients? Rules for us, no rules for them. Same pattern, different scale. And I want you to see something about healthcare. It wasn't just my employer, it was 3 players, and each one made the other 2 even worse. Player 1, the for-profit healthcare corporation, extracting maximum productivity from clinicians, cutting support, increasing caseloads, paying less for more work. After all, how are they supposed to make infinitely more money every quarter? Player 2, insurance companies. Prior authorization delays, leaving my patients without medication for days. And a lot of the psych meds, people get sick if they don't have their meds, never mind decompensating. So the insurance companies denied the coverage for their meds, which meant appeals, which I wrote for free on my own time. And the high deductible plans they had too. They were forcing my patients to choose between their appointment and buying groceries at the start of the year. I filled out the extensive disability form so my patients could get medical leave. It took hours. Again, my time, for free. And the claims were denied regardless of the clinical evidence. Because the disability company has a fiduciary responsibility to the stockholders, not to the patients. Player 3, the pharmaceutical supply chain. This was great for me because I specialized in ADHD. The Adderall shortage. It's going on for years now, it still is. Still happening, and I had hundreds of ADHD patients. And it wasn't just Adderall. There was a trickle-down effect. So Adderall, Ritalin, Vyvanse, Dextrine, Focalin, any of them. So patients would have their medication and then all of a sudden unavailable. And some of them had bipolar disorder, depression, anxiety, and people don't get ADHD, but without the meds, all that other stuff gets worse too. Some of my patients called hundreds of pharmacies looking for any ADHD stimulant in any form to help them function and to not decompensate. And the people who are in the biggest need of medication are the people least equipped to navigate a broken system to get it, with severe depression, anxiety, unstable. That's not an accident, that's a design. Each player creates problems that compound the others. Insurance denials create patient crises. Patient crises increase clinician workload. Then clinicians have more workload, more hours, and get burnt out. And then the management policies also reduce quality of care. And this reduced quality gives insurance companies justification to deny more claims. It's a closed loop. And everyone inside it, patients and providers, we're all being controlled. So let me tell you what happened to my patients, like hundreds of them, over and over. And I'm talking to hundreds of people every quarter. They had a decent job. Benefits like health insurance, better than the marketplace policies. They built their lives around that income. Mortgages, kids, bills. Then over time, the working conditions start to erode. More hours, less support. Gaslighting when you raise concerns. Coercive control. You want to leave. But can you find a job with the same pay, same health insurance coverage in this economy? So you stay, and it gets worse. And finally you leave and take a job with less pay, worse benefits, or no benefits at all. Now you're scrambling for marketplace coverage, paying COBRA costs at eager savings, rationing your own medications because you can't afford the out-of-pocket costs, without meds for ADHD, anxiety, depression, bipolar disorder. Whatever they were stable on, whatever you were stable on, you can't function as well at your new job now. You underperform and you feel like a failure. And part of you starts thinking, maybe I should have stayed at that abusive job. It was better. At least it was stable. And that's the trap. The system doesn't just control you while you're in it. It makes leaving feel like your fault. Same architecture as domestic violence relationship. The same reason people stay. And here's the part they didn't teach me in nursing school. Healthcare systems, schools, social services, they recruit people who care. That's the business model. Find people whose identity is built around helping others. People who will work late without being asked. People who will absorb impossible caseloads because a patient needs them. People who feel guilty for saying no. Then they exploit that sense of purpose until you break. And when you break, when you're crying in the parking lot before your shift, when your body starts shutting down, when you can't remember your patients' names anymore, the system replaces you. Everyone's replaceable. And tells the next person they need to be more resilient. Mission statement language in an institution. It's the same version of an abuser saying, I love you, as they hurt you. In both cases, it's used to extract more from you than is sustainable. And in both cases, when you believe it, you hand over your power to them. My second COVID infection, severe, long COVID followed, brain fog, kidney problems, body aches. And I then fell down the stairs and injured my spine. I was in severe pain with limited mobility. I needed a medical leave. The company's response, as I mentioned before, they didn't have a policy for covering prescriber medical leave. It was inconvenient. I had to hire a lawyer to obtain basic medical leave for me. After 25 years in healthcare, after working through a pandemic and mental health crisis, I gave my heart and soul to my job. But now I was burned out and sick and in pain, and it was going to take a long time to get better. So I resigned. I lost my career, my income, my professional identity. Nurse had been who I was for 25 years. But after I left, I was alive. I was recovering, and I could finally see the pattern from the outside. This is about a pattern. The same 8 mechanisms that operated in my marriage operated in my workplace. Isolation, surveillance, economic control, gaslighting, exhaustion, intimidation, permissive asymmetry, gradual escalation. If you're a nurse, a teacher, a social worker, a first responder, a caregiver of any kind, and you're reading this and seeing this and thinking, that's my job, I want you to know it's not you. And this happens in other industries too. I'm not limiting the coercive control tactics to this group. It's a system. The employer class uses it against employees everywhere. And no, you're not alone. Next is video 4. The same pattern at the largest scale. How coercive control operates at the level of a society. How throughout history, every time a population has been subjected to these same 8 mechanisms, the population has eventually recognized the pattern and said, no. Same cards, final level. If you need support right now, crisis lines are on the screen and in the description. And if you're a healthcare worker who's struggling, the 988 Lifeline is for you too. You don't have to be the strong one all the time. I'll see you soon.